Hello, this is the fourth in our series of short videos demonstrating the key components of the care protocol used in the Gastroschisis Interventional Study in Ghana, Zambia, Malawi and Tanzania. This video is focused on tips and tricks for preformed silo use. Firstly, which silo to use? We are using this Alexis wound protector and retractor, extra small, 2 to 4 centimeters, produced by Applied Medical. This is about 1/10 of the cost of the purpose-made preformed silos used in high-income countries. There are also videos available for making preformed silos using local resources. Those are preferable than using a female condom, because a female condom, the ring is often too flexible and can pop out, and this component is very weak and often splits and allows the bowel to spill out. So use either a purpose-made or a makeshift preformed silo preferably. So next, what to do if you're faced with a particularly small neonate. We found that neonates that are 1.5 kilograms or less, the green ring of the Alexis silo fills the perimeter of the abdominal wall, and you can actually use the other end, this white end, cut off the external ring. Make sure you use a sterile blade or scissors so that it's still sterile to insert into the abdomen, and also make sure it's still smooth so there's no rough edges to damage the bowel. But you'll find this has a smaller diameter and is more flexible for the smaller babies. So what to do if you have a particularly small defect or hole in the abdominal wall that's 2 centimeters or less? You can still use this Alexis silo, insert the green ring and tie up the silo from above quite tight for the first 48 hours without doing any bowel reductions, and you'll find the defect stretches up and comes to a more normal size for you to be able to proceed as you normally would. However, make sure you diligently watch the bowel colour, because when inserting an Alexis silo through a small defect, you have to manipulate it and twist it to get it to go in, and that increases the risk of twisting the bowel during silo application. So monitor the bowel regularly. If there's any discoloration of the bowel, remove the silo, check the bowel's not twisted, and then try reapplying it. If you find the bowel still becomes discoloured, you can make an incision to enlarge the size of the defect slightly. We only do this when necessary, because what we've found, if you've put an incision, the defect can stretch up more quickly while the silo is on, making it slightly higher risk for the ring to pop out towards the end of your period, reducing the bowel. So tips for keeping the cord moist. What we started using, and what many centres still use, is the wet gauze covering the cord, wet regularly with saline by the nurses day and night, and also checking that the cord is completely covered to the base, because if it slips up, the base of the cord can dry out. If you're having problems keeping the cord moist, there's an alternative, which is tucking the cord in to the abdominal wall at the time of silo application, and you can see that the cord is then inside. Make sure it's fully in, and at the time of closure you can do a finger sweep and pull that back out, ready to use. So what about tips for avoiding the silo popping off? Firstly, make sure the baby remains on their back at all times. You can have a folded sheet or towel around the baby to keep them in position. If you're doing a procedure like cannulation, make sure you loosen the silo, because manipulating the baby with this tied up can actually pull the ring out. Also, once you have reduced the bowel by about half or more, you don't have to have the silo tied so tightly from above. So relax it slightly so the bowel is still upright, but not tied so tight, and you'll find that then the defect doesn't stretch up so quickly. Also, make sure you try and reduce the bowel ideally within 5 to 7 days to reduce the risk of that ring popping out. Finally, what about minimising risk of infection? So the Alexis silo has this black string at the bottom. It has a pendant at the end normally that you can flip over the top or tie it up as I've shown here, and that prevents it from dangling in the nappy, which is a direct route for bacteria to enter the abdomen. Also make sure that you keep the abdominal wall and the cord as clean as possible. Regularly clean it to minimise the amount of bacteria that can enter the abdomen through the hole in the abdominal wall.